Welcome to the second topic in our series about family involvement in dementia care. Family caregivers may feel tense in conversations with providers. The ideas that we will talk about in Don't Be Shy will build on ones we reviewed in our last presentation, Talking with Providers. The main goal today is to help family members speak up, politely and clearly, in conversations with providers. That includes feeling comfortable asking difficult questions, offering information, speaking up for yourself and your needs, and also staying focused on the issues that are most important to you. As a reminder, this presentation is one part of our training series about family and provider partnerships, which involves working as a team to assure your loved one with dementia receives the best possible care. Being a partner with providers means you are equals in discussions and decision-making. It involves both sides focusing on good communication, asking questions or for explanations if something is unclear, bringing up concerns with the care routine, and being prepared. As we discussed earlier, the goal today is to review ideas on how to feel comfortable and not intimidated by providers, and to be polite but clear about what you want to know, what you already know, what you think is best for your loved one, and how you can or want to be involved in their care. If you are ready, let's get started. There are many keys to having a successful discussion and relationship with healthcare providers. But let's start with the concept of being polite but clear. Another word for being polite but clear is assertive. It means expressing your feelings, thoughts, beliefs, and opinions in an open manner that doesn't violate the rights of others. Being assertive is different than being passive, which violates our own rights and places priority on the needs of others, or aggressive, which violates the rights of others. Being assertive means we are respectful of ourselves and others. Being assertive may be challenging at times, partly due to stereotypes that we may have learned while growing up. We may be accustomed to the belief that men who show or talk about their emotions are perceived as weak, or that women who state their needs and opinions are seen as aggressive, or even that disagreeing with experts is considered disrespectful. These misconceptions are common and can inhibit open and honest communication, and they can stand in the way of the partnership approach to caregiving. Not saying what we really think or believe can have serious consequences, such as feeling powerless or not being in control of our lives, or feelings of resentment, tension, anxiety, or anger towards the provider, which can lead to unhealthy and uncomfortable relationships. When thoughts or feelings are bottled up inside, it can lead to frustrations that come out in other ways, in quiet but hurtful comments or criticism, or in bursts of anger that cause other problems. Saying what we think only during these aggressive episodes is often unproductive and can lead to a loss of respect or avoidance by family, friends, and others. And frankly, when we respond emotionally, others tend to stop listening to our message altogether. Being assertive is not always easy. Here are some helpful tips about being assertive from family caregivers. If you have difficulty being assertive with providers, bring an assertive friend with you. Remember the impact that all care expectations have on you as a caregiver. Don't be afraid to speak up and say, "I can't do it," if the expectations are too much in terms of being physically demanding, emotionally demanding, or time-consuming. Keep in mind that you are an important part of the team and that your needs should be recognized, discussed, and addressed. By being assertive, our opinions, beliefs, and ideas are expressed in a respectful way. It isn't always easy, and it can be especially difficult when emotions are running high. Let's talk a little more about how to handle difficult conversations and emotions. While feeling frustrated, angry, hurt, and resentful are understandable responses to stress or feeling that providers aren't hearing or understanding you, how that frustration is expressed can make or break both the conversation and the relationship. Also, keep in mind that sometimes aggression can be communicated by more than just our words. It is important to be aware of our gestures, body language, and tone of voice during our interactions as well. An important starting point is to think about the kinds of situations that can be challenging, which varies from person to person and can change over time. Work to recognize emotional triggers such as a particular situation, setting, person, or topic. It can be helpful to keep a diary or log, which simply means writing down who or what tends to be upsetting, and then thinking about how you might approach things differently. Another approach is to use I statements, meaning that you are talking about your thoughts, feelings, reactions, or needs. This helps by avoiding placing blame on another person and shifts the responsibility back to you. There are lots of ways to use I statements, from letting the other person know how you feel or think, to telling them what to expect if they don't follow through on an agreement. Following these 4 steps can help when anger or frustration run high. First, describe the situation objectively. Avoid interpreting or placing judgment. Second, clearly and specifically say how the situation impacts you. Third, describe your feelings. And fourth, state how you would prefer the situation to be addressed in the future. It's hard to argue, disagree, or become defensive since you are talking about your personal thoughts, feelings, and preferences. You aren't accusing, judging, or criticizing the other person. Feeling stressed or frustrated can also lead to unhelpful thoughts that can develop into much bigger problems. This is a little bit like carrying a grudge. Work to recognize these unhelpful thoughts by pausing to think carefully about what has happened. And then try reframing your thoughts and your perspective. Is the person just having a bad day? What other factors might need to be considered? If the situation seems to be a pattern of repeated problems or behaviors, then it may be a signal to intervene and address the situation with the provider. For this breakout, let's take a look at a real-life example that a family caregiver has experienced. Lucy was visiting her husband Mike at the care center where he lived. She arrived during lunch and noticed that another resident sitting at Mike's table was wearing the sweater that she had bought her husband for his birthday the week before. If you were Lucy, how would you have responded? How would you have addressed the issue with the provider? Please pause the presentation to discuss, and then when you are ready, press play to continue on. Our last discussion point leads us into our next section. Let's look closer at a few approaches to keep in mind when having a difficult conversation. Having a respectful, polite but clear conversation with a provider is often best started with an I statement. As before, this can be something you think, feel, understand, or want. Then, follow up with a question, request, or statement. Partnerships between family and providers often rely on both sides having an understanding of the options and limitations related to care. A key to being assertive is exploring the options by asking about the pros and cons of available options, as well as other possible choices. Once you know the options, you can evaluate your choices based on your values, situation, and needs. Does the decision make sense at this stage in the disease? given your loved one's possible other health conditions? Based on their long-standing wishes? Does it make sense financially and given your other demands such as work, leisure, or other family commitments? Being prepared also means being ready to politely but clearly stop a conversation. You may want more time to think about the options or get input from others. Pausing can also be the best approach if you are feeling upset or frustrated. Time for a quick discussion break. Do you ever feel that the provider questions or doubts what you are saying to them? How did that make you feel? Please pause the presentation and then press play when you are ready to continue on. Using the approaches we have just discussed can help facilitate conversations with a variety of health providers and caregivers. Your comfort level with having these conversations may not come easily in the beginning, but it will become easier with practice. Mistakes and misunderstandings are bound to happen occasionally. However, if you observe that miscommunication and related problems are an ongoing pattern with a particular provider, it might be time to try another option. Although exploring options takes time, energy, and has its own set of challenges, over time it can pay off. Ask yourself what or who else is available, and what are their qualifications? Working with providers that share your interests and concerns and who treat you like a partner in care can greatly improve your ability to navigate the caregiver journey and improve the quality of care for your loved one. There are many things to consider when talking with providers and being assertive. Remember, being prepared for the conversation is key. Be open and honest. Work to recognize your emotional triggers and reframe unhelpful thoughts. Use I statements to avoid placing blame. Check for understanding, ask questions, and explore your options. Don't be afraid to pause the conversation. Excuse yourself and regroup if needed. In our next presentation, we'll explore the give and take process of finding the best solutions to care questions.